Virtual health is really about using technologies to support health. How can we do what we do today better using technology? And how can we deliver care that historically is impossible? There are several ways that patients can clearly benefit from virtual care. If they can see their own health information, if they then do their own scheduling for clinics, it can improve their communication with the health professionals. And also to access services. If because of physical limitations I can't leave my house, it'd be very useful technology for me to be able to access those services. And then finally is to co-create the future of virtual care.
Virtual health has become very exciting. You can get a lot of information out of virtual conversations. You can decide what testing to do. You can often decide what treatments you can obviously prescribe. And so you really don't need to see them in person to be able to treat them.
Virtual health can really help an individual to own their health. A person, usually when they're sick, they go see their doctor, they go in the hospital. That's about 1 to 5% of their lives. For the rest of their lives, we really don't have any data. But what virtual care and patient portal can help us to understand is, what do I look like when I'm normal? So having that data when the person's normal, and when we see them abnormally, we can make that comparison with the patient, and the patient can also pick that up themselves.
I use a health application on my phone, and this measures blood pressure, pulse, temperature, blood sugars, and we're given a very specific range that we need to be within. And if we ever do fall outside of those ranges for consecutive tests or readings, then that's usually an indicator that something is wrong. It's very reassuring because it can actually help validate whether we are indeed not doing so great. And all of that data is shared during our meetings with our healthcare providers.
One key principle I incorporate in all my virtual care research is to make sure that we have patients with lived experiences to be part of the research. I'll be able to partner with our patients to say, are we going the right direction? For example, our ED app is an app to help us to understand what would an emergency patient go through as he or she goes to the emergency department to see a doctor. The idea of this app is to support them in every part of their journey, from the waiting room to seeing a doctor, to waiting for blood tests, to waiting for referral, to going home. COVID has been clearly a defining moment for digital health because of the importance to have physical distancing, deliver safe care, and also many patients in isolation, and they worry about needing to go to physical facilities to see doctors and nurses. Because of this, digital health has been propelled to the forefront. I don't think we'll ever go back and not use digital health again. I really appreciate donors who want to contribute to better healthcare functions. Without research grants, without philanthropy supporting these types of services and research, I wouldn't have the type of experience I have to make sure that we can fulfill that mission to serve our patients better. Thank you very much for supporting the VGH and UBC Hospital Foundation.